spectrum disorder, ASD.
We begin, though, as always, keeping them honest. Breaking news tonight. Just hours ago, the British medical journal BMJ did something extremely rare for a scientific journal. It accused a researcher, Andrew Wakefield, of outright fraud.
I got a call on the 19th of May 1995 from a mother telling me the story of her child, his regression into autism following a vaccine. And I said, how can I help you? I know nothing about autism. You've come through the wrong number. And she said, no, doctor, my child has terrible gastrointestinal issues and no one will take them seriously. I was an academic gastroenterologist doing research with a particular interest in Crohn's disease and ulcerative colitis, inflammatory bowel disease. I knew nothing whatsoever about autism. When I was at medical school, it was so rare, we weren't taught about it. We heard a succession of stories which were very, very similar. Medicine is about pattern recognition, and there was a clear pattern emerging. So we decided, a group of us, including the world's leading pediatric gastroenterologists at the time, led by Professor John Walker-Smith, decided that these children merited thorough investigation.
Well, Dr. Wakefield has been shown used absolutely fraudulent data. He created a fake paper. The journal allowed it to run. All the other studies were done, showed no connection whatsoever, again and again and again. So it's an absolute lie that has killed thousands of kids.
And what we discovered and reported for the first time was this link between what appeared to be a novel type of intestinal inflammation and autistic regression in previously developmentally normal children. And among those, the majority had regressed into autism, according to their parents, following the measles, mumps, rubella vaccine. It wasn't our place to censor their story because it may be uncomfortable for public health. Our job was to report that story accurately in order that it might lead to further investigation. And the paper explicitly said, this paper does not prove an association between MMR vaccine and the syndrome described. More work is needed to resolve this issue. That was the conclusion of the paper.
As an investigative medical journalist, I've spent the last 7 years working on one of the best medical talk shows in the world. We know in medicine that there have been many, many studies proving that vaccines do not cause autism. But the problem I have always had with that is thousands and thousands of parents all telling the same story. My child got a vaccine, usually the MMR vaccine, and then that night or the next day broke out in a fever. And then when they came out of the fever, lost speech, lost the ability to walk, basically regressed into what we know as autism and never came back. Doctors used to be told to listen to their patient. That was the cornerstone of medicine as we know it. But something's changed recently where the patient doesn't know what they're talking about. And these parents, with their story of their children, have just been written off as though they have no idea what's really going on with their child. I have 2 kids. And anyone that has children knows that when we first have babies, we are overly sensitive to every little hiccup, every cough, every sniffle. So to say that a parent was just unaware that their child had issues, and suddenly they realized 1 year later that, oh, they have autism, that doesn't make sense to me. And so I wanted to look into this story and find out, what is this disconnect between medicine, science, and real parents?
I couldn't wait to be a mum. I remember specifically, before we even got married, talking about how important children would be in our lives.
I wanted a daughter first, and I wanted a son. And we were planning on having 4 children.
We were going to be the most perfect parents that we could be.
Bella was born, and that was a wonderful experience.
Bella was just this angelic, perfect child. She hit all her milestones. I got pregnant with Billy quite quickly.
Bella, say hello to Billy.
Hello. We've now got a beautiful girl and a beautiful boy. Life was just amazing. So at 2, 4 and 6 months, Billy had his normal baby vaccines. A little bit snivelly, chesty, coldy after maybe the last one. So me, in my perfect mother mode, rushed to the doctor. Is he okay? Do I need to give him anything? Yes, you need to give him antibiotics, just to make sure there's not an infection in there. It didn't clear up. Rushing back to the doctor, we need more antibiotics, let's just keep this going in him. And I remember my mother calling me out, my mother's a sort of homeopathic hippie, and calling me out saying, what are you doing? You're chucking loads of antibiotics down your son, for what? And I'm saying to her, Mum, with all due respect, you're an artist, and they're doctors, so they know best. He was due his MMR vaccination at 12 months. So the morning, exactly to the day, my friend, she said to me, listen, I've heard that there may be a problem with this vaccine we're about to take Billy for, the MMR. And I said, are you crazy? What is the matter with you? If there was a problem with vaccination, it would be headline news. The doctor would be calling me up saying, do not bother coming in. This is not a safe vaccine. None of that is happening. You're being negative, you're being careless, and you're listening to, what, some rumour that you heard somewhere. Billy could become deaf if I don't take him in now and get him this MMR.
Most of the evidence linking measles with autism is kind of settled down, and most of the doctors and scientists agree that it probably isn't the major cause.
I've been working in pediatrics for almost 20 years. I think most pediatricians view vaccines as they're the #1 thing they do for kids. Okay, there we go. All right, okay. I'm young enough to not remember the days of kids in an iron lung because they were battling polio. polio has essentially been eradicated from this country. In '98, the Wakefield study came out. My son had just been born. That study kind of pointed a finger at the MMR. As a parent, I was scared to give the MMR to my son. And as a matter of fact, I didn't give it to him on time because I wanted to see what additional studies would show. And over time, additional studies did show that, no, it's safe. And so he did get the vaccine. If everybody stopped vaccinating, we'd be going back to the dark ages.
When a CDC scientist who'd been there at that time 17 years tells you this is how you access data, it didn't take me very long to realize, oh, I better do what he says, because he knows what he's talking about.
I just want to tell you one thing. Right now, I'm sitting in a very pretty position in terms of providing you a lot of information.
He asked me, what data sets are you going to request? And I said, well, I'm going to request 2 of the studies that you've done on thimerosal, the mercury-containing preservative that's used in some of the vaccines. And he said, well, that's fine, but I want you to request the MMR data set first. And this is the study by Frank DiStefano and his colleagues in 2004.
It was the one study where we could end up creating a mess while the CDC tried to sort out something they couldn't understand.
The day Billy got the MMR was a living nightmare. It was the worst day of my life, to be honest with you.
I came in and I saw him lying in his cot, listless. He started this uncontrollable shaking. Imagine coming out of a frozen pond.
His eyes were doing this and he was shaking like this.
And I remember she grasped him and held him really tight to her chest.
There's immediate fear in John and there's immediate, Mummy, this is not going to happen. I don't know what is wrong with you, but this is not going to happen. And we get to hospital, we rush him in, doctors are coming in and looking at him, and that's when they said, he's had a reaction, he's had a seizure, this is normal, this is common for many, many children who have this vaccination. It's absolutely okay, he's going to be fine. Nobody ever told me that there would be any side effect to any of the vaccinations my children had.
Following his febrile convulsion that he had the same day of the MMR, we were told to take him home.
He slept in the bed with us for the night. He seemed just very, very sleepy. In fact, he didn't really ever wake up to the Billy that we had before.
For me, it became really necessary to start looking at what types of medical issues are these children going through? What are the other factors that have affected them, that have brought them to this level of symptomology that we call autism? This is now probably the mid-90s. I came to notice that there was a very high use of antibiotics amongst these children, but B, what became pretty interesting was seeing the number of families who were reporting that their child had a regressive type of behavior occur right after their vaccinations. A lot of these parents were showing me footage of their children who had been completely developing normally until 18 months, and then all of a sudden post-vaccination had developed incredible regression. Children who had speech anywhere close to 50 to 100 words and had completely lost all of their words. Children who were extremely attached and interactive with their parents and had suddenly become isolated, no longer responding to their own name. And this was all happening right after their MMR vaccines.
My oldest son, Ian, was born normal, developing normally. He was this beautiful boy, and we ended up at our 12-month visit, which is his 1 year. Then they gave him multiple vaccines at once. And within 7 days, he had a 104 fever and a rash all over his body. He had previously been noted in our videos, home videos, that he was walking and actually running at that point. 7 days after the vaccine, he was no longer able to do that. He was falling down. He became a really sick little boy.
So the question for those of us investigating autism is age of exposure to MMR a risk for autism? And in order to understand why that might be, you have to understand something of the history of MMR vaccine. In 1987, there was an MMR vaccine that was being used in Canada, produced by SmithKline Beecham. And that vaccine caused meningitis. It was recognized quickly, and that vaccine was withdrawn in Canada. However, in the same month that it was withdrawn in Ontario, it was licensed in the UK. The name was simply changed from Trivirix to Pluzarix. In the UK, it was used for 4 years, and likewise, it caused meningitis and had to be rapidly withdrawn. There was a public outcry, there was an acute loss of confidence, by the public in vaccine policymakers, and the vaccine should, at that point, have been destroyed. It wasn't. It was then shipped to developing countries like Brazil, where it was used in a mass vaccination campaign. And there was an epidemic of meningitis, which was entirely predictable. Now, scientists studied that epidemic, and what they found is that the risk for meningitis was associated with age of exposure. The younger you got the MMR vaccine, the greater the risk of meningitis. For people like me investigating autism, the question was, is there a similar risk in autism? Is age of exposure to MMR a risk for autism just as it was for meningitis? We shared with the US Congress and the CDC the hypothesis.
The story as told to us, which we have an obligation to report, is that the majority of children regressed following a period of normal development in the face of MMR vaccination. That does not mean it is the cause of the disease.
The Institute of Medicine is a body of scientists and physicians that review the available data on vaccine safety and then advise our government on vaccine research policy. Well, because Andy Wakefield had put forth this theory that the age at which you receive the MMR may increase your risk of autism, the IOM looked to the CDC to do that very study. It was a study about timing. Does the earlier you receive the MMR vaccine increase the risk of autism?
When we talk about the MMR study, nobody had ever requested those data because it was a big secret that you could do it. Thompson told me to email such and such a person, and then on the inside, I also found out that one of the people preparing these data sets for me was Bill Thompson.
They don't really want people to know that this data exists. Again, I just can't believe we actually got you that data.
Thompson couldn't send these documents directly to Brian Hooker because that would have been illegal. What Thompson identified was a legal loophole that is referred to as a citizen's request. That allowed Thompson to deliver to Brian Hooker potentially classified information in a legal way.
You get checked in England with your babies at certain times, by health visitors. So at 9 months, Billy had his full-blown check, and it says no parental concerns, baby laughing, babbling, talking. So we passed that with flying colours. 18 months is when they next come in. And by this time, we know there's something seriously wrong with Billy.
Are you constantly feeling tired, gaining weight, or